Eye allergies. Believe your eyes and see what they may be telling you. If your eye itches, are red, tearing or burning, pay attention to what they may be telling you. You may have eye allergies or allergic conjunctivitis, a condition that affects all human beings. It is a condition that can occur alone, but often accompanies nasal allergy symptoms such as sneezing, sniffing, and stuffy nose. And while most people treat nasal allergy symptoms, they often ignore their itchy, red, watery eyes. Allergy symptoms. Common symptoms of allergies include red eyes, swollen eyes, tearing or itchy eyes, runny nose, sneezing, coughing, difficulty breathing, itchy nose and headache from sinus congestion. Above and beyond the eye allergy symptoms, there are telltale signs that someone may be suffering from allergy eyes. These eye allergy symptoms include a scratchy feeling in the eye, redness of the eyelids, blurred or unclear vision, swelling of the eyeball, the sensation that something is in the eye, swelling or puffiness of the eyelids. What causes eye allergies? Just like hay fever and skin rashes, eye allergies develop when the body's immune system becomes sensitized and overreact to something that is ordinarily harmless. An allergic reaction can occur whenever that something, called an allergen, comes into contact with your eyes. The allergen causes certain cells in the eye, called mast cells, to release histamine and other substances or chemicals that cause blood vessels in the eye to swell and the eye to become itchy, red and watery. Different types of allergies. Atopic, vernal keratoconjunctivitis, a seasonal recurring conjunctivitis which can also affect the peripheral cornea, generally occurring in children and young adults. Atopic keratoconjunctivitis, a similar entity to vernal keratoconjunctivitis, but occurs mainly in older patients who have had a history of atopic eczemated dermatitis, is not seasonal, and can cause more extensive corneal and conjunctival scarring if untreated. Hayfever conjunctivitis, a sudden intense response to an usually airborne allergen. These type tends to be short-lived and episodic. Also known as seasonal allergic conjunctivitis, adverse or allergic reactions to medications. IgE mediated anaphylactoid, one of the 5 major classes immunoglobulins present primarily in the skin of the mucous membranes. A sudden intense reaction which often includes chemosis, conjunctival swelling, and an urticarial response, intense itching. Common offenders include topical penicillin, bacitracin, sulfastamide, and anesthetics. Toxic irritative papillary reactions, very common and result in a chronic red eye, can occur any time after 1 week of medication use and are due to some antibiotic and antiviral drops as well as certain preservatives. Allergic contact reactions are slower and more gradual in onset than the above two, caused by many topical medications and easily treated by discontinuing the offending agent. Seasonal allergies. Find out what seasonal allergies are, why they differ from perennial allergies, and how you can avoid them. Outdoor allergies. Find out what causes eye allergies when outside and ways you can reduce exposure to the allergies that cause them. Indoor allergies. Learn about the causes of eye allergies inside the home and how best to manage them. Seasonal allergies impact those who are susceptible only during certain months of the year. Most sufferers of seasonal allergies typically have their strongest allergic reactions during the spring and fall months. However, depending on the person's allergic sensitivity, he or she may feel symptoms year-round. Treatment. Atopic allergies. Cool compresses and artificial tears are often helpful. Topical vasoconstrictors and antihistamines are useful to counteract the histamines-induced leakiness and dilation of blood vessels. Many of these are now available as over-the-counter preparations. Topical steroids may be used in severe cases. Mast cell stabilizers, cromolyn sodium, lodoxamide can be used in seasonal cases and are most effective when instituted before or soon after the onset of symptoms. These agents limit the body's sensitivity to an allergen, resulting in less of an immune response. Medication allergies. Discontinue the offending agent. Topical vasoconstrictors and antihistamines provide relief, and artificial tears may help remove any remaining medication and lubricated the corneal surface if irritated. Preventions. The best way to prevent eye allergies is to avoid the source of the allergen. Once you and your eye care professional identify what substances are triggering your allergies, you can take steps to reduce contact with them. The American Academy of Allergy, Asthma and Immunology recommends the following environmental control measures to minimize contact with pollens, molds, and other substances. Close windows and doors. Avoid windows or attic fans. Minimize humidifiers used to reduce the spread of molds. Wash bedding in hot water frequently so that dust mite don't proliferate, and use allergen-proof covers for pillows, mattresses, and box springs. Stay away from curtains and draperies that may harbor dust. Remove stuffed toys from children's reach. Avoid furry animals. Avoid irritants such as tobacco smoke, perfume, potpourri, chalk dust, and markers. Limit pillows, bedding, draperies, and other linens such as dust ruffles and canopies. Reduce the number of knickknacks that collect dust. Minimize carpeting that can harbor dust mites. Clean regularly and thoroughly to remove dust and mold. Eliminate water leaks and standing water that encourage mold growth. Use barriers and filters. Use allergen filters in both furnace and the air conditioners in your home. Also be sure to change them regularly. Preventing contact lens allergy. Decreasing lens wear time, ensuring proper cleaning of lens, and perhaps changing the cleaning regimen may improve this condition. In addition, recognition to early symptoms is essential in limiting this problem. Example: if 8 hours of wear feels fine, but then the eyes get red and irritated, it is wise to remove the lenses then and not to continue to wear them for hours more. The symptoms and prevention described may not necessarily mean that you have allergies of the eye. However, if you experience one or more of these symptoms, contact your eye doctor for a complete exam.